we have a good one that I think is just a great review to go over, and that's what even is leaky gut or intestinal permeability?
Ah, good. Well, if you'll start with that, and I'm going to find them here today.
Sure, and I am a big fan of pictures, so I'm going to share this picture right here of pathogenic intestinal permeability is the proper name, right, Dr. Tom? And leaky gut is the slang. And so this would indicate pathogenic intestinal permeability through the cells in the gut and between the cells in the gut.
Why do we use the word pathogenic, Michelle? What does that mean?
Because these tight junctions right here, zonulin, is really designed in a way to have some flexibility of opening and closing and allowing individual nutrients out, individual amino acids. It shouldn't be torn open or stuck open where peptides of food or pathogens, parasites, viruses, yeast, pathogenic bacteria are leaking out into the bloodstream. Now, the cell is never designed to be torn open. There should never be intestinal permeability through the cell, but there should be some permeability between the cells, but not pathogenic, which indicates causing disease.
Right. So I'll do the cheesecloth analogy.
Excellent.
So, Mrs. Patient, your digestive tract and your gut starts in the mouth and it goes to the other end. It's one big long tube that winds down, around in your abdomen there. It's about 20, 25 feet long. The inside of the tube is lined with cheesecloth. And just like when your grandmother used to pour gravy into the cheesecloth, only the liquid comes through. The bigger molecules, the clumps of flour or something, can't get through. It gets stopped by the cheesecloth. So the inside of your gut is lined with cheesecloth, because if you drop an apple on the ground or something, pick it up, wipe it off and eat it, if there's some dirt on the apple that gets, it's not supposed to get into the bloodstream. And the way the apple gets absorbed into the bloodstream, it gets digested, chewed up, broken down into small pieces, really tiny pieces, but the dirt is not supposed to get in. That's what the cheesecloth is for, is to only let really small molecules get through. But when you get tears in the cheesecloth, now you've got bigger molecules getting through. They're called macromolecules, big molecules. And it doesn't matter if it's tomato or chicken or strawberries, whatever it is, these big molecules get through, and your immune system trying to protect you says, holy cow, what's that? That's not some raw material I can use to make new bone cells. I better fight that. And now you make antibodies to tomatoes or chicken or strawberries. It doesn't matter what the food is. So when people do these 90 food blood tests to see what foods might be a problem, and it comes back and it's 15 or 20 foods, and they say, oh my God, that's everything I eat. Well, of course it is, because you've got a leaky gut, tears in the cheesecloth, and these bigger molecules get through into the bloodstream, and then your immune system, trying to protect you, fights those molecules.